Hey, everybody, guess what? We're here with Harpeth Valley Dermatology, and they're here to give us all the things. I just learned, I'm so shocked. I just learned so many interesting things just in a couple minutes, but we're sharing them with you. The month of May is Skin Cancer Awareness Month, and they have some really interesting things to share with us. How's it going today?
Going great. How about
Going
with
really
you?
good.
Good, good, good. So let's talk about it. You just told me the month of May is Skin Cancer Awareness Month, and you have some really interesting things to share with us. Tell us about that. Tell us about skin cancer. You told me some things that I was shocked to hear.
Mhm. Yeah, no, the three big skin cancers are basal cell carcinoma, squamous cell carcinoma, and melanoma. Luckily, basal cell is not necessarily an aggressive form of skin cancer. It can be in some ways. And, a basal cell is the most common cancer in America. So not just
Mm,
skin. Um, basal cell and squamous cell skin cancers are from cumulative sun exposure over time, even dating back from childhood. Squamous cell can sometimes have a relationship also with HPV, actually, so viral particles as well. And
mm.
melanoma has a relationship with the sun as well, but it tends to be more due to intermittent bursts of sun exposure, like blistering sunburns, such that 2 or more blistering sunburns increases your chances for melanoma, and 5 or more blistering sunburns increases your chance by like 50%. So quite a bit.
Wow.
You know. So yeah, the month of
Wow.
May is all skin cancer awareness for those big three.
Wow. So tell me about things that we can do. I know I always hear, and I go myself once a year to get a skin check just to make sure there's nothing suspicious or anything that needs to be looked at. Do you guys recommend that as well?
Yeah, definitely. Based on your sun exposure history, usually I start recommending annual full body skin exam probably around the age of 40 for most people in Tennessee, um, being because it's a very sunny state. Actually, 1 in 5 people in the U.S. develop skin cancer. So, like Dr. Shoureshi was saying, it's very common. So, usually it's in an area that you can't see it. So, getting a full body skin exam done by a board certified dermatologist ensures that we're checking out your back and backs of the legs, areas that you can't easily see. Usually, a skin cancer starts as like a pimple that's not healing or a lesion that's not bleeding. So, or that's not a pimple that's not healing or a lesion that keeps bleeding. So, if you have a spot that's not going away after a month, a pimple should not last that long. So, we definitely recommend following up with your either primary care doctor that can refer you to a dermatologist or just calling a dermatology office directly because skin cancer is definitely something that's very treatable when it's caught early.
And I'd
Hmm.
say outside of the annual skin exams, which can also be based on family history sometimes. So if there's like a family history of melanoma with a first degree relative, even if you're of age 20, 30 at a younger age, it's good to get a yearly skin exam because genetics can play a role with melanoma, especially, and increases your risk. But I think the other thing is just avoidance of the sun if you can, and good sun protection if you are going to have a lot of sun exposure, whether it be the appropriate sunscreen use, SPF clothing. So that kind of thing is also key.
Hmm. Yes, so that's a little bit of the preventative care. Is there something else that you recommend to help prevent skin cancer?
I think, one of the most alarming thing is we were talking earlier about tanning bed use. Um, you know,
Which I
and
didn't even know people were still doing, by the way.
yeah, and then quite a
Yeah.
few are, unfortunately. And, tanning bed use has a high correlation with melanoma.
Yeah.
And what were you telling me earlier that,
Using a tanning bed more than 5 times increases your risk for melanoma by like 75%.
yeah,
So it's impressive just because the UV radiation you're getting from the exposure of a tanning bed is almost double that of what you would normally get from laying out at a beach. So it's a significantly higher index of radiation.
and there's a higher correlation between tanning bed use and melanoma skin cancer as compared to smoking and lung cancer, which is kind of an
Hmm.
alarming fact as well. So
Mm-hmm.
that's probably one of the, avoiding UV light as best as you can. We're all going to be outdoors in the sun, but doing the best we can with sun protection, but also trying to avoid things like tanning bed activity would be good. And, spray tans, as we talked about, is a popular item these days, and there's nothing wrong with doing that.
Okay. I feel better now that I can keep trying to get a spray tan. I don't have one right now. I need one. Tell us what else that we should know about Skin Cancer Awareness Month.
Yeah, so I know we talked a little bit about prevention. SPF 30 or greater is what you want to look for in terms of a daily sunscreen. I always recommend to my patients to make sure you're wearing sunscreen every day. A lot of people just think that they need to put it on if they're going to the beach or they're going out to the soccer field, but every time you walk to check your mail, you're being exposed to UV rays. So finding a good daily moisturizer with at least SPF 30 in it is a really helpful way to be very preventative upfront about avoiding skin cancer. The big ingredients you want to find in a sunscreen is titanium or zinc, and those are physical blockers. So they block UVA and UVB rays very well. So that's definitely the most important thing to look for in a sunscreen. HelioCare is a nice oral supplement that's over the counter that helps to decrease your risk of sunburn, and it protects your skin from the sun. So that's something I recommend to a lot of patients. And then he mentioned the fabric, the clothing. There's something called UPF that's in fabric that can almost make your shirt it makes your shirt a sun shirt. So if you're going to be golfing or at the beach, it's a lot easier to protect your skin than having to slather on, especially with children. Those UPF sleeve sun shirts make it a lot easier than chasing your kid around to the beach with a spray can, which we don't recommend sunscreen in general. But it's just a lot easier to have those sun shirts, and nice wide brim hats are great because, a lot of people forget their ears when they're putting sunscreen on. A lot of people forget the backs of their neck. And those are areas that we treat a lot of skin cancers. So
yeah, you mentioned sunscreen and ingredients to look for. Are there any brands that you recommend that maybe you could get at your local pharmacy or, when you're at your grocery store that you guys like to tell people to try?
Yeah. The biggest brands out there and the ones that I use personally is Neutrogena. Aveeno makes a lot of good sunscreens, CeraVe and Cetaphil. And a lot of sunscreens say 6 months and above. So for children below 6 months old, you'd want to use more sun protective clothing. But 6 months and above, I love Coppertone, Aveeno, Neutrogena.
But even with these brands, within them, some of them have more chemical sunscreens, some of them have more of the physical blockers. So it's important to still take a look at it and see if it's truly zinc or zinc and titanium, because head to head, that's always better than the chemical sunscreens. Plus, it doesn't have as much of the controversy associated with it.
Right.
And also reapplication, making sure that you reapply every 2 to 3 hours if you're going to be out in the sun for a long time.
And that's where I think a lot of people forget, myself included. Yeah. Like you were like, oh, it's been about 3 or 4 hours. I should probably add some more sunscreen.
Right. Yes. Time flies when you're enjoying a day on the boat. So making sure to bring that sunscreen for reapplication is very important.
Yes. And I've seen, you mentioned clothing, but I've also seen hats that have that extra protection in them. Is that something we should invest in as well? Or is just any hat good to keep your face out of the sun?
No, definitely a UPF hat is something I recommend daily to my patients. And a lot of times they've got more of those bucket hats that, again, protect the back of the neck. Because even a baseball cap or a straw cap, sun's still getting through there. With women, I see a lot of skin cancers in the hair part. So if you're out there gardening, you absolutely want to have a UPF hat on. And we have a lot of golfers in the area. So for golfing, still trying to bring that style into the golf course. My golfers don't agree with me, but a bucket hat will definitely protect you on the golf course. But yeah, a baseball cap or straw cap is better than nothing, but you can still get a lot of damage through that fabric.
And who knows, it may improve your golf game too.
There you go.
Never know.
There you go. You may start something. You mentioned interesting, I never even thought about my part that could get skin cancer, but there also are other interesting areas that I think people heard about. I think I had a friend who had something under her arm, and she never thought that we never probably applied sunscreen under your arms, but she had a small spot there that had been exposed to sun.
Yes, absolutely. You can get skin cancer anywhere. You can even get melanomas in your mouth. You can get them under your fingernails. You can get them on your palms and soles. In darker skinned individuals, the most common area for melanoma is on the palms and soles, mucous membranes in the mouth. So anywhere where you notice a spot changing, a lot of times women who are getting pedicures don't always take a look at their toenails between paintings. So I always counsel them on making sure that you check out your toenails between paintings because it is possible to get melanoma there. Bob Marley actually died from melanoma from a spot under his right big toenail, I think.
Yeah.
So
Oh, wow.
it's surprising where it can grow.
Wow. All right. Well, if people are still looking for information or they want to come get a skin check, you guys are still taking new patients. Tell everybody about that.
Yeah, so we're still open in both offices 5 days a week. We have an office in Thompson Station and an office in Smyrna. There's 3 of us here. We're all 3 board certified dermatologists, so you're guaranteed to see one of us when you come in. And we also offer Mohs surgery in our office here, which is the best treatment option for skin cancers on the head and neck. So highest cure rate with best cosmetic result and smallest scar. So we're still accepting patients. You can make an appointment on our website or you can call in to schedule an appointment. But I hope that we've raised awareness during this month because it's just a very important thing for everyone to consider and think about. Not even just during May, but summer and year round. But
all year round. Well, hey, thanks for joining us. Tell us more about that. Before we go, any last words, anything else you want to make sure we say to everybody about taking care of your skin this summer? Because the weather is, have you noticed, it's going to really keep we warm. We're all going to get outside this weekend.
Yeah. No, wear your sunscreen. If you have any doubts about any new spot that's changing, bothersome, do not hesitate to see us. All of these things are very preventable and curable at a very high rate if we get on it early. So it's good to not procrastinate.
Absolutely.
All right. Thank you. Thanks so much. We'll see you soon. Bye, everybody.
Thank you.